Hi, good afternoon, everyone. Welcome to our workshop today. Today, the workshop topic is about developing functional skills. It will be presented by our in-house occupational therapist, Miss Alia. Okay, and then also we are proud to announce that this year, My Story will provide two short courses. One is Skills for Skill. It's about it will be done by our occupational therapist, Miss Alia, to teach about skills that needed to get ready for school. As well as another one is special education basic course by our in-house special need educator and also our reading therapist, Miss Serene. So they will talk about special education. What are the education needed for school? All right. And then a short introduction about us. Our team consists of different types of therapists, academic support, special needs teachers, behavior therapists, clinical psychologists, counseling, occupational therapists, reading therapists, as well as speech and language therapists. And also, we provide services to those who have academic delays, sensory delays, developmental delays, behavioral and emotional difficulties, as well as physical delays. Okay, you can contact us at this number and or email us. We provide free consultation, and you can check us out at Facebook, our LinkedIn website, as well as Instagram. Okay, now I would like to invite Miss Alia. Good afternoon, Miss Alia.
Hi, good afternoon.
Okay, all right. So let's get started with your workshop today.
Yes. Okay. So today, we're gonna share about a developing functional skill, which is how we can help the child to develop the functional skill. So before we start, I want to share my slides so the participants can see and can take note from my slide lah.
Yep. Okay, so today we're gonna talk. We have received many feedback last year, about requesting a workshop about developing functional skills, skills that are not really taught much at school. As per the feedback, we requested Miss Alia to prepare some to talk about some of the skills based on the occupational therapist point of view. All right, let's start.
Alright, so we're gonna start about the developing functional skill activities today, that how we can help the child to develop the functional skill. So before we start, I want to introduce what is the functional skill for a child. So a functional skill for a child is a necessary skill that require for them to perform daily living and establish a quality of life for a person. We can see the functional skill that we can elaborate for the child is like communication, work, education, performing daily living activities such as feeding, toileting, dressing, bathing, and so on. And it's also included the education parts as a functional skill for a child. So, functional skill is important to develop a great independent skill. So, as older people, we know that the occupation is for us is to go work, to perform daily activities, but it's different for a child, which is like a toddler, like preschool students, that one enhance their functional skill, so they need to go play with their friends, play independently, or play with their siblings, as well as they need to go to school.
Okay, Miss Alia.
Yes.
Okay, so for those who have questions, feel free to ask. Can drop in the comment, so I can refer the question to Miss Alia. So I have a question.
Yes.
So these functional skills also something that is it something similar like ADL, activity daily living?
Yeah, functional skill is something yang is connected with ADL activities, like we do dressing activity for a child, how the child can perform independently the toileting activity, feeding activities, and so on.
Yep.
So
Yeah.
that's called as a functional, how the child can perform the task.
Okay. Also, you mentioned that as an adult, normally a lot of people don't understand the term of occupational therapist. So, like just now, Miss Alia did mention that occupation for adult, the job of occupational therapist is to help us, right, to get back to our occupation.
Get back, yes.
That's why the name occupational therapist.
correct.
For adult, our occupation is go back to work or do adult functioning skills.
Functional skill.
So for child, you did mention that our occupation as a child is to play, and then
Yes.
from play we move to school.
School, correct. So because they doesn't have any specific occupation that they need to do except for play and go to school. So that is the reason why it's important for a child to have ability to play independently and also to go school and to perform the functional activity at their school. Okay, so before we start in depth of this topic, I want to introduce what is the foundation or what is the model that we need to use to check how our children performance in future. So basically, we can see the pyramid of learning. The bottom part is the central nervous system where it is about how the internals in our brain to perform the function their function, like how they are connected with the brain. So that's known as the central nervous system. So we going up to the next level, which is the important area for a child to have and to develop enough before they can perform more functional activity, is a sensory system. Sensory system that we have that we know, actually we have 5 basic sensory system. So the sensory system that basic we have is olfactory or smells, visual to see, auditory to hear, gustatory to taste, and tactile is for touch sensation. While she had discovered another 2 area for sensory, which is vestibular and also proprioception. Vestibular is how a child or how a person to maintain their balance when performing a task. Like for example, how they can walk properly, how they can sit in a proper position, how they can balance themselves when standing in a short or in a narrow base. That is the vestibular. While for the proprioception is how they're aware with their joint and the muscle function, like how they can know they need to use the finger to hold the pencil, how much of the strength they need to, how much of the strength of strength of the
Finger.
yeah, strength of the finger to hold the pencil.
So the basic sensory that we always hear is smell, taste,
Yes.
visual, and touch.
Correct.
But from OT, there's another two that we need to be aware, like you said,
Yes.
vestibular and proprioception.
Proprioception.
Okay.
And actually all of the sensory system is connected with one another. Like example, vestibular, proprioception, and as well as tactile, they always come together, because when a child have a problem with the tactile, like hypersensitive, then they can contribute with the difficulty in maintaining the balance, as well as to produce how much strength they need, which is the proprioception area.
Okay, so all the sensory system, they work together.
Yes.
Okay.
So after the sensory system, we go up another one more level, which is sensory motor development. This area will help a child to develop how they can use their sensory to transmit or to produce the result through the action of a child. Such an example, awareness of two sides of body, which is how they can aware they have right and left side. So from the sensory system, if they have developed enough the sensory system for proprioception, so they can develop in sensory motor, which is awareness of two sides of body, so that they're aware that they have two sides of the body, which is the right side and also the left side. So same goes with the motor planning, ability to screen input, reflex maturation, body scheme, as well, and postural security.
Okay. So meaning that if the proprioception in the sensory is underdeveloped or is not
Yes.
properly developed,
Yes.
the awareness of the body side they don't have. So meaning
Yeah. It's,
right, left, they cannot
yeah.
differentiate.
They maybe have a difficulty to discriminate between left and right side.
So, so that's when if the child is in school, the teacher said to your right or to your left, the child will
Correct.
get confused.
Correct. Because of they're not aware with the size of the body, so and have a difficulty to focus with the instruction given, so they have a difficulty to perform sensory motor development.
So you also mentioned motor planning, meaning that if the child not aware, so in terms of motor planning, they don't know how to start the task.
Correct. Some of the
Okay,
child
so
maybe they don't know how to start, or some of the child maybe don't know how to stop the task.
so they, like, for example, pick up the pencil and start writing.
Start
So
writing.
they don't know which hand to pick up the.
Yes, maybe they don't know which hand to pick up, or maybe they don't know how to initiate holding the pencil. Some of the child maybe just pick up by grasping the pencil, then they continue writing with the grasping position.
So the different,
Yes.
I mean the not correct way of holding pencil.
Yes, correct. That's
So
how.
okay, so
That's
for
why.
those,
Yeah, that's why the sensory system is the most important development, or it will act as the foundation for a child before we go to the higher level.
okay, so sensory is the most basic
Yes,
things that we address. Then we go for sensory motor development.
correct.
Yeah,
So
the reason why I ask is because I have some parents that ask me about what actually is proprioception. Because normally if we study in school, we only taught about 5 senses.
correct.
So
So
now,
because of the 5 senses, we don't know that why the child cannot sit still, while the child difficult to hold the pencil. That's all because of another 2 more area of sensory that we have.
yeah. Also at school, we can observe why is the child don't know how to start or initiate activity. So this is all related to the proprioception. So they don't know how to start or they don't know how to end the activity.
Correct.
So all the sensory will reflect on the
Reflect.
sensory motor development.
Correct. Yes. And then we go to the another one more level, which is the perceptual motor development. This one is more complex for a child, where they need use a lot of motor function as well as the fine motor skill, which is using the higher level of cognitive function and higher level of muscle, small types of muscle they need to use, which is like auditory language skill, which is how they can use the auditory to produce a speech. So that's mean the auditory language skill. Visual spatial perception is how they can use a visual to discriminate left and right side, up and down, in front and back area. Attention center function is how they can use how they can perform a task in a longer time, or more attention they give to the task. Eye-hand coordination is how they can use the eye the eye and the hand movement. Like example, we do cutting activity, we need to use the eye, which is the visual part, and also the hand coordination. And then oculomotor control, how to control the eyes function, and posture adjustment, how to adjust your body in a proper position or in a correct space. Okay. Next, when a child have a good enough development of sensory system, they have developed the sensory motor development, then they have a perceptual motor development. There is the child can produce a better cognitive intellect.
So, okay. So that's where we talk about daily living activity, the functional skills,
Correct.
the behavior, the learning. So that is the top of the pyramid.
Yes.
So before that, when we always see is the red part. Like,
Yes.
yeah, at
We always
school,
see terus we just go straight to the daily activity, school activity. We don't see the another 3 level for the
yes.
child.
So normally we see the child at school if they have academic learning difficulties, they cannot perform daily living activities like brushing teeth. That's
Yes.
where we have to check one by one from sensory to the motor development, sensory motor development to the perceptual motor development. So
Yes,
have to go one by one lah.
correct.
So,
That's why.
so if let's say the daily living activities or academic learning is affected, then we have to
Going down the stairs.
so we start with the sensory, the basic, and then
Yes.
slowly move up lah.
Correct. That's why in OT we always see we always take mention or take note about sensory system, because not enough developing of sensory system will affect the another areas such as for the gross motor functional and also for the fine motor function, and it
Okay.
also affected the cognitive area too.
Yeah. Okay, Alia, we have a question.
Yes.
If the kids cannot sit still, is relating to which part? Then kid want to touch thing and other table, and other people to kacau people when eating.
Oh, okay. The first question is when a child have difficulty to sit still, it affected the vestibular part, proprioception part, as well as the tactile area. Because when a child need to sit still, they need to have a good balance, and they need to aware their proprioception or their muscle and joint function, as well as the tactile, because some of the chair yang normally the child have difficulty to sit when the chair is hard surface. So they tend to go walk around, go kacau someone like that. So because of the the tactile area and the vestibular part not developed enough.
Okay, so Miss Kimberly, for the activities later, Miss Alia will share what kind of activities that can help for attention skills. Now we're just talking about the introduce about the pyramid of learning, because most of the time when we talk about learning, we only focus on learning, but we hardly openly talk about what is affecting the cognitive intellect, which is the academic learning, which is the top part of the pyramid. But basically, we require the skills below to build up the academic learning. Yeah. Okay.
Okay. So next we go to the factors affecting class participation, which is why the child have a difficulty to perform the task in school, and what is the causes that usually cause them to have difficulty to perform. The first one is unable to sit still in class, like I have already said before, which is the child maybe have not the child maybe have underdeveloped of the sensory area like tactile, vestibular, and also proprioception that cause the child have difficulty to sit still, because when a child need to perform sit still in a class, they need to use a lot of attention, they need to use their muscle function, a good muscle strength, a good sensory sensory system like tactile and vestibular, and they also need to have a good uh, just now good sensory motor and perceptual motor development, because we just see a child to sit, but we don't know what behind of the activity, behind of the performance. So that's why some of the child that we can see they have difficulty to sit because of the normally that I see is because of the sensory, hypersensitive with the tactile and hypersensitive with the vestibular, and difficulty to sit still in for a long time. The second one is difficulty to stay focused and follow the instruction given. This one will need a child to have a lot of performance, or they need a lot of area they need to cover. Like example, they need to, like example, we refer back to the pyramid. When they need to focus, they need to use their all visual as well as the auditory area. Then when to follow the instruction, they need to perform the sensory and perceptual motor development, where they need to know what is the motor planning, how they can to
Continue, carry out the activity.
to carry out the activity through the ability screen input, as well as the auditory language skill and visual spatial perception. Because when they need to focus, they need to use a lot of area to carry out the task.
Alia, we have
Yes?
a question.
Mhm.
If the kids is good in balancing beam and sports skill, can it still affect sitting still and focus skills?
It can affect because maybe because of this tactile area, because normally we can check if the child have a good balance, have a good proprioception, which is they know they're aware with the muscle function, but we need to check all together with the tactile area. Maybe the child have hypersensitive to touch sticky or to do brushing. So we can also check the reflex, either it still appear or the reflex already developed enough for a child.
So basically, if the kids have good proprioceptor and vestibular, then we will proceed to other sensory, the other five,
Correct.
to see which sensory is affecting the focus skills and the sitting skills. Because it, like you said, there's maybe visual area is hyper, or some other places that will affect the attention.
Yes.
Okay. All right. Thank you.
Okay. So next, the another factor that affect the child is tend to refuse to do handwriting tasks. This is the most common why the child has referred to OT, because normally as well as the has difficulty performing cutting tasks, it's also same like if the child refer to OT because of they can't do writing, they can't do cutting activity, or they maybe can't do fine motor skill activities. So this one normally because of they do not know how much of the strength they need to give to hold the pencil, or they maybe have a difficulty to perform proper finger isolation or or how to perform holding the correct pencil or scissors. That's why they always like they always like refusing to do the task. Like if teacher asks the first time, maybe it's okay, but for the second or third time, maybe they will refuse to do the activity. Okay, next is has difficulty to making friends and tend to feel low self-confidence. This because of when they can't perform the task, they maybe develop one more feeling, which is low self-confidence. So for them to express their feeling, they tends to tantrums or to kacau someone or to just get out from the situation. That's why they like to that's why they don't like to do the task. They just develop a new behavior or new character in the class. And the last one is difficult to perform physical activities such as running, jumping, or physical class activities because they maybe have low self-confidence to perform because of their easily to falling down or not good imbalance, or maybe they're difficult to run. That's why they feel a low self-confidence and difficult to perform in class participation. So we already talked about the pyramid of learning and the factor affecting class participation. So because of today's topic is how to develop the functional skill, we will go one by one from the most basic area, which is a sensory part. So as I already tell before that our sensory, we have touch or tactile, visual, gustatory, proprioception, smell, hearing, and also vestibular. So all of these area will connected one another. Normally, like if a child have a difficulty with touch, they maybe have difficulty with touch to maintain their balance, or maybe the child have difficulty with auditory area. They maybe has difficulty with the balance as well as the touch and also the proprioception. Or maybe a child have difficulty with smells. They will also have difficulty to perform or to interpret the result of gustatory. So because of the sensory is the most important area, so a child need to have a good sensory performance to perform a basic or to perform a higher level of task. Commonly, we know that sensory that we always hear is hypersensitive and hyposensitive. So all of the 7 sensory, we will assess either the child have hypersensitive or hyposensitive. So hypersensitive is normally we can see the child will avoid with the stimuli, while hyposensitive we can see when a child tend to seek for the stimuli. So if the child, okay, like example I give, like one child maybe can do tearing paper, but when doing a collage activity, they need to use a glue. Maybe at that time they don't want to use the glue, then they just go away from the task. So that's maybe because of he or she have a hypersensitive with the tactile sensation. So that's why they show another act or another behavior.
Okay. Oh, okay. So meaning that if a child, if they experience hypersensitivity, means a lot of stimuli means like input, sensory input.
Mhm.
So like you said just now, where when doing cutting and sticking, suddenly they stop doing activity, maybe
Yes.
because they don't like the sticky glue.
Yes, correct. Maybe they don't like with the texture. That's why we need to ask to the parents. Either your child ada have any issue to touch certain texture.
Mm. So that one meaning that is so the when the new behavior is out, that's
Mhm.
where we can see past refusal. The
Yes,
child
correct.
refused to engage in activity.
Correct.
Okay.
That's refusal. So, if the child love to play with the glue texture or with the messy activity, they maybe have the hypersensitive with the sensation, because when a child try to stick with the sensory or sensation, they always like craving something to satisfy their feels, to satisfy their uh, sensation to in to the input uh, in their body. So because of that, they try to do another things, like example, they try to play and with the texture, try to put the texture on their body, something like that.
Okay.
Mhm.
So hypo means something is missing.
Yes, something they're missing and they're craving to get it.
Okay. So it's like there's some cases where I've seen parent asking,
Mhm.
why is my child when they use a phone, they will put the phone near to the ear.
Uh,
But it can be like seeking, looking for
yeah,
auditory
because normally
signal.
when the child put their phone near to their ear, that maybe because the child try to seek the sensation where it is come, where why the sound is coming from there, what
Mm.
happened to that. So that's why the child try to seek the sensation. They put
Okay.
the phone lah.
And then sometimes I see parents or teachers say that the child's playing saliva,
Mm-hmm.
and then they start licking the table, they lick the pencil. So it can be also maybe the area of in the oral
Yes.
unseen.
Yeah, they maybe because of their oral area have a hypersensitive, or try to seek something which is the hypersensitive, or maybe it because of the oral area have a weak muscle, because
Mm.
in another condition, in another situation, maybe because of the weak muscle, like the oral area can cause the saliva, drooling saliva.
Okay, and some they might be picky in eating.
Yes.
So they only eat crunchy stuff. They don't eat soft stuff. So that can be seeking as well.
Yes.
And
If
then
the
like
picky eater,
some of them will start biting the baju,
ah,
and then bite the
buy
what
the
cake,
toys,
bite
yes.
the toys. Okay, okay, got it.
So normally that we can see that picky eater, maybe they don't like the texture of the foods, or maybe we can see normal child like to eat crunchy food. All of this normally is because of hypersensitive at their gums. So the oral area is hypersensitive, so they try to avoid with the soft texture. So they want to get the feeling, the sensation, so they eat just crunchy foods lah.
Okay, yeah, because normally when I see parents, they do share with me about this. So sometimes I'm curious because
Yes.
I'm not an OT, so okay. All right, that's great.
Okay, uh so because of so the sensory area is the most important part for a child. So we want to know what happened if the child is hyper or hypo. Like we have already said before, maybe they have a difficulty to sit still and stay focused. because of they try to seek or try to avoid with the situation, so they have difficulty to sit and focus. They also tend to easily distracted because when a child have hypersensitive with the auditory, which is like easily to hear something from outside, they will be easily to distracted to fall. Then when he or she difficult to easily to distracted, then it lead to difficult to stay focused in the class. So all of this normally it will be connected with one another.
Alia,
Yes.
we have a question.
Mm-hmm.
Keep biting fingers, is it hyposensitive?
Keep biting fingers. We need to see either normally we can see that they're hyposensitive because they want to find the stimulation or sensation on their hand, because some of the child they do not aware with the joint of the fingers, why this one is moving. Sometimes if because of that they try to bite their hand or fingers.
All right, thank you.
Okay. Another one is they tend to refuse performing art activity or avoid to enjoy some physical activities. This one normally because of the sensory input is overload or under responsive with the sensory input lah. Okay, next we go to the another one area that a large, not too large as sensory lah, but for me it's quite large for developing a child, because if a child have a good sensory input, they must have a good gross motor and also fine motor skill. So we go to the first area, which is the gross motor skill, where it is an activity that involves the large muscle in arms, legs, and torso. Torso is the body area, which is the upper body and the lower body. So gross motor skill required a lot of using our arms, our legs, and also the tongue muscle. So for the gross motor skill, normally we can see how their upper limb or lower limb strength and how they perform the bilateral coordination, how they control their balance, and how their muscle can have a good endurance. Endurance is how they can sustain to perform a task in a several repetition. So some of the child maybe have a good strength of upper limb, but not good in endurance. So when a child have poor endurance, they tend to refuse to repeat the task. Like example, running activity. Maybe they have a good strength of leg muscle, but the endurance is not good enough, so they just do one time, then after that they want to take rest and want to avoid from the activity. Maybe it's like that. So that is the meaning of muscle endurance. And for us, normally muscle strength and muscle endurance will come together to see how the child can perform a task. Is it good enough for him or for her? Or maybe the activity they need to practice more to help him or her to perform the task repeatedly. And another one area is the fine motor skill. Fine motor skill is the area where we perform a task that involve a small muscle of hand. So normally we love to hear about gross motor, which is we use a large muscle, like we do walking, we do standing activity, swimming, running, and so on. But we don't forget about the gross motor area. The we don't forget about the fine motor area, because fine motor skill need a lot of small muscle in our hand. So for a child, when performing activity in school, they will need use both of the motor skill, which is the gross motor and fine motor. So when they can perform a good gross motor skill, doesn't mean they can perform a good fine motor skill. So to help them to improve both of the motor skill, we need to practice more with our child from their age, from early age of development of our children. Like 2 years old, we start to introduce some of the fine motor skill, some of the gross motor skill. So they will go, they will develop the more, or they will develop good performance in future. So before we start the fine motor skill, I want to highlight the area for the gross motor skill that normally OT will check is a control, balance, the strength, coordination, and endurance. So all of these 4 areas can help for a child to perform better performance in fine motor skill.
Alia,
Yes.
can you explain a bit bilateral?
Oh yeah, bilateral coordination. Okay, bilateral coordination is the activity that we use both of our side of body. Like example, we maybe use both of the hand, both of the leg, or both of the hand and leg activities. Maybe bilateral activities is like swimming activity. I give the example swimming activity. We need to use hand strength to move forward, and leg to, what is that? Kayuh belakang. Kayuh bahagian belakang.
Okay.
So swimming need to use both of the side.
Okay. So most of the like sport activity also they need bilateral, means both hand or both leg lah.
Yes, correct.
Like playing badminton, you need hand and leg. Run and or catching ball, kicking ball. So those are the bilateral coordination.
Correct. This is a bilateral. So we can so for bilateral coordination and control, balance is normally come together in a task.
Okay.
So if we want to see in the ADL activity, so in the activity daily living, you can see how a child can perform dressing activity or bathing activity.
Okay. So muscle endurance is about how long they can do the activity. If they
how many repetition of they can do the task.
So if they tired, means the endurance are quite low lah.
Yes. Mean if a child easily tired, so maybe the endurance is low.
So they stop after one repeat, then they stop the activity. Like let's say they throw one time of the ball and then they stop. So this is where we look at the muscles endurance.
Yes. So normally we just like compare with the normal child. Like example, a normal child maybe can do throwing activity 10 times. But for them, maybe have a low endurance. So maybe they can throw 2 to 3 times. Then after that, they take a rest for a long time and don't want to do the task. So that's known as a muscle endurance. Okay, all of these activities, we can see if a child can perform in ADL activity. Like example, dressing, we need to use the bilateral coordination on, as well as the balance, and also the strength, maybe a little bit strength, because like example, if a child need to dress to pakai seluar, so bila dia nak pakai, so when they want to wear their pants, they need to stand, then they need to have a good balance to stand and strength.
Okay, so they need to lift one leg
Lift
up so
one
they
leg.
can pakai sebelah lah.
Yes, that's use the balance, and that's also use the coordination skill. If not, they have difficulty lah to masukkan kaki dalam seluar.
Okay, so it's a combination of bilateral because both hands have to pegang seluar tu,
Correct.
and then they have to control the balance so they tak
Balance.
jatuh, and then they need to use the leg and trunk muscle and hand.
Correct.
So the hand to pull, the leg to stand one leg,
Yes.
balancing, and the trunk, so ada yang they will bend the body, so they have
Yes.
lah.
So that's why in OT, in one activity where we can divide into a several area, because when we do the task analysis, we can recognize, oh, this area have a difficulty for them, or this area have they can't perform the task like that. Because when we see as a one area, maybe it's have a difficulty in several parts, so we go depth to check either this area have they have developed enough or it is underdeveloped. Okay, so next we go to the fine motor skill area, and this area we have a lot of specific area that we need to cover. So, fine motor skill requires small muscle of hand, which is how the child can perform the task will influence the quality of task as well as the speed of task performance. So, fine motor skill will involve hand dominance, in-hand manipulation, hand control, crossing midline, gripping and pinching, eye-hand coordination, finger strength, and finger dexterity. Okay, for hand dominance is how we want to know a child which hand is their dominance. Like some of the child maybe use the left hand, some of the child maybe use the right hand. So it requires more practice, like for a child to recognize their dominant hand. This one will normally develop after 3 years old, because when a child tend to use one hand, like tend to use right hand to pick up some things, to write, so that's mean the child maybe is a right-handed person lah. Same as the left-handed child. Next is in-hand manipulation.
So all this activity will normally after 3 years old lah.
Yes, but not all the activity, because some of tasks maybe developed from baby, from age of 1 month. Maybe they try to play with the activities that we have provide for them, so it will develop in future lah. Okay, next is in-hand manipulation, which is in-hand manipulation is how the child perform a task in their hand. So how they manipulate the things in their hand. We have 3 types of in-hand manipulation, which is shifting, translation, and also rotation. Shifting is how we use the fingers to turn the paper, to turn a card, how it shifts. So the movement is how to shift like this, from this one to this one.
Sorry, Alia.
Yes.
We have a question. Sorry, it's about the bilateral coordination.
Okay.
Does bilateral coordination involve hand and legs only?
Yes,
Okay.
it involves hand and leg, because yes, only hand and leg, because we have hand and leg two sides, not like the eyes and the ears. That one is can't moving lah.
Okay, so not about the whole body or both sides, shoulder, hips, not lah. So bilateral is just hand and leg.
Actually, it's hand and leg, where means we use all of the hand. From the shoulder to the fingers is all of the hands.
Okay.
If the lower limb is, or the leg is from the hip to toes.
Okay. So from the hand, for the hand bilateral, is
Mhm.
both hand from the shoulder until the finger.
Yes,
So for leg, is
hip
from
to
the
toes.
hip until the toes. Okay. Oh,
Yeah.
right. Okay.
So
Thank you.
some of the bilateral activity maybe use the right side or left side only. Like example, when we walking, we will use right hand and left leg to move forward, while left hand and right leg to at the back.
Yeah.
If we can notice, we will move like swing movement. So that's also include in the bilateral coordination.
Okay. Sometimes it's the same, sometimes it's opposite lah. Like
Yes,
cross
correct.
lah. So when you
Crossword.
walk, is right and left leg, and then you take turns like that lah.
Yes, that also known as a bilateral
Bilateral.
coordination.
Okay. All right.
Okay, so we continue back with the fine motor skill in hand manipulation. For the shifting part is how we shift our hand from palm to dorsal area. So like turning paper, we turn our hand, like we turn a cards like that. So it's known as a shifting. For translation is how we translate some things from palm to tip finger. So for the translation, actually we have two types, which is from palm to tip and tip to palm. So normally we use this technique when we want to translate coin in the piggy bank. So we put the coin in the palm. So we move like this one. We pull the coin until the tip of finger. That's mean of translation. And the last one in hand manipulation skill is rotation, which is how we can rotate to how we can use the hand to rotate. Like the example, we want to open a container lid. So we need to hold the lid and turn. So this is rotation, or like how we use a screw. So how we rotate the fingers, that is rotation. Okay, that's all untuk for in hand manipulation.
So that's all in hand manipulation lah.
Yeah.
Okay. All
In
right.
hand manipulation, the important thing is we have 3 types of the in hand manipulation lah. Next is a hand control, is how we control the hand. So for hand control, how we can control and how we can manipulate the performance. Like example, how we can manipulate to hold the pencil, how we can move the hand, that is hand control. So for in-hand manipulation, it's more on how we use the activity with the palm and finger.
Tapak tangan lah.
Yes.
Okay.
But for hand control, how we more manipulate movement of fingers, hand movement is more on hand control.
Hand lah. Okay, so in hand manipulation is here, and then for
correct.
hand control is the whole hand lah.
Whole hand
This part
movement lah.
Okay, so turn, twist. Okay.
Yes, correct. And also not forget for finger isolation, it also include the hand control. Finger isolation is how we isolate one by one. Because correct, that is a finger isolation. Normally, the child that having problem with the fine motor skill, they will have problem to isolate their fingers. So that's why the difficulty for them to hold the pencil in proper way, or to hold the cut the scissors in a proper way, because they have difficulty to isolate their fingers. Next is a crossing midline, is how a child can perform the activity crossing the midline, which is from right to left. That means a crossing. or left to right. So crossing midline usually we can use to reach at something in another side, or when we do the activity, ADL activity, maybe we need to wear the shirt, which is want to put the hand in in the hand, dekat shirt tu. Contohlah kita nak masukkan tangan dekat tempat tangan tu, so kita kena one hand to hold, another one hand to go in and pull out. That's mean the crossing midline lah.
Okay, crossing. Okay. So we can see this a lot in writing, right?
Correct. So in writing, sorry, the internet is lost.
Okay. All right.
So
So the crossing midline we can see a lot in writing because
yes,
the child have to know where to start writing, right?
correct. So crossing midline is important for a child to perform the better handwriting lah. Next is a gripping and pinching. Gripping more on how a child to grip the things. Gripping normally we use all of the fingers, which is like we grip the fingers. While pinching, when we use the tip of fingers. So for gripping, we have spherical grip, we have hook grip, and we have another one more, disc grip, and also the cylinder grip. This is the gripping. While for the pinching, we have three types, which is tip pinch, lateral pinch, and also three-point pin. Three-point pin, normally we use this one. So for gripping activity and pinching activity, usually it will develop along the way. More especially for gripping, because gripping is we use like a large muscle of the hand. While for the pinching, we need to train a lot, because normally we only ask when a child try to pinch, they tend to pinch like this. They're not pinch like this or this, because of the finger strength is not strength enough for them. So that's why we can see some of the child try to pinch something using all the hand, like they put the clothespin here and then they clip pinch like this. They not pinch like this because of the finger strength. Okay, for the eye hand coordination, it's almost same like bilateral coordination, but only for eye hand we use the eye and also the hand as the we use the eye as the for receive the input and hand as the output. So eye hand coordination, usually we use the activity like clipping on the string or cutting activity, as well the eye hand coordinate as well as the writing activity.
Yeah, this one we can see a lot in school when the kids have difficulty copying.
Correct.
Right? So when
Correct.
the teacher draws something
in the whiteboard, so
yeah,
they need to use the eyes lah.
Okay, and then input is from the eye, output then they have to write.
Correct.
So if the eye and hand coordination is underdeveloped, so what the teacher write on the whiteboard, the child will have difficulty copying lah.
Correct. That's why we need to train for the eye-hand coordination too lah. Okay, next is finger strength. Finger strength is like how we use the pinching activity just now lah. So finger strength is more on the what is the strength for the finger to pinch a certain object. And for finger dexterity is how smooth a child to perform the task. Finger dexterity more focus on the strength, more on the speed of the task lah. So finger dexterity will develop in a child when they can perform handwriting. So how smooth or how fast they can perform the copying task. So that's mean the finger dexterity. So for performing a better handwriting for a child, they normally need a lot of fine motor skill where it will include the finger dexterity, finger strength, eye-hand coordination, gripping, crossing midline, hand control, and hand dominance. So that's why it sometimes have a difficulty. Some of parents will ask why my child is difficult to write while my child can't perform the handwriting activities. Because all of the small area lah.
Okay, so meaning that if the child has difficulty writing, cutting, or doing small activity with finger, if they can't perform, normally the fine motor skills have difficulty, and this is what OT will check one by one, right?
Correct. So because handwriting is a large area to cover.
So you have to see all the finger, the hand.
Yes.
Okay. All right.
So the activity that will involve the hand fine motor skill, actually in our life we use a lot of fine motor skill and also the gross motor skill, not forget lah. Because when we do the writing activity, shoes lacing, cutting, holding keys, feeding, all of this we use the fine motor skill. But in the same time, to perform the better fine motor skill, we need the large muscle, the good large muscle.
Okay, so like you mentioned just now, sometimes we also wonder why the child cannot perform at school or cannot perform activity like pakai baju, wearing shirt. So these are the things that we need to look at, the gross motor skill as well as the fine motor skill, because they both work together, right?
Yes, correct. Because these two areas work together.
All right. Okay. Thank you, Alia. So for those who join us, if you have questions, feel free to put in the comment section. Yeah.
Yes.
All right.
Okay. So now we go to the another one more level, which is visual perception. Other than sensory and motor skill, we also need to tackle the visual perception. Normally, this one we will forget lah, because it's like a visual is same like sensory, but actually it's not same. Because in the visual perception is they stand alone, where they have a several area or several types need to be covered. So visual perception is how our brain ability to perceive our surrounding through the light that enter to our eyes. So that's mean how we interpret what we see. So in a visual perception skill, we have 8 types, the important 8 types, which is a visual discrimination, spatial relation, closure, sequential memory, figure ground, visual memory, form consistency, and visual attention. So for visual discrimination is how a child to discriminate from discriminate the things that they see. Like example, when we do hidden figure activity, how they can discriminate which object they need to find and which the object they already have in the picture. So that's mean that this visual discrimination. Normally, visual discrimination will come together with visual attention, with how the visual to stay focused or to have the attention towards the worksheet. So for them to have a good visual perception skill, they must have a good visual attention and visual discrimination, but not forget the another types of the visual perception. And next is a visual spatial relation is how they discriminate right and left side, up and down, and also in front and back. So that's the mean of spatial relation. Spatial relation is the area surround us. For visual closure is how they interpret the object that they already know for in their brain. So like example, we already tell about pencil. So we already showed a pencil for them. Then after a few minutes or a few hours or maybe the next day or another day, they already keep in their mind how the pencil look like. So that's the mean what is the visual closure. For visual sequential is how they know the sequence of the task or how they know the sequence of the activities. So visual sequential actually normally we can apply when a child want to do dressing or want to do something like handwriting to write A to Z, 1 to 10, something like that. So that is a visual sequential. Next is a visual figure ground is how they can discriminate between the figure in front and the background at the back. Normally we can see the figure ground is like how we can see in an advertisement or in a hidden figure, find the differences, picture. All of that required a child to use the visual figure ground abilities, which is how they can discriminate the picture in front and the background at the back. Next is the visual memory. This one is almost same like the sequence memory, but visual memory more on how they can memorize the thing. Like example, teacher give a certain number like 1 plus 1 is 2, then teacher asks them to memorize it, and for the next day teacher will ask again, so either they can answer it or not. It use the visual memory abilities. Okay, next is the form consistency, is how they can consistent the form, which is the size of the object or the shape of the object or maybe the colors of the object. It is the form consistency. So the same like example, we do find the same color or find the same object or find the same size of object. So all of the activity is known as a form consistency. For visual attention, how they can pay the attention to what they see. Like example, in the class, when teacher writing at the whiteboard or blackboard, then they need to give a focus on that. After that, they can interpret what the teacher write into the what is that? What is the book, into the books that they need to write on the paper lah. So all of the type is important for a child to perform buttoning activity. Reading, this one is the most important task for a child. Recall memory, writing, performing cutting activity, and recognition, colors, shape, and size. So normally some of the parents or some of the teacher will just ignore the visual perception and more focus on fine motor and gross motor skill. Because visual perception, sometimes we just take granted that maybe the child have a good vision, but we don't know that they maybe have a difficulty with the perception. For the visual perception, normally we can see the example like in the class, when the teacher writing in the whiteboard. So they need to discriminate what the teacher have write on the board. Then they need to have a visual attention what teacher have write on the board, and then they need use the memory to transfer the words in the board to the books. So that's why there is a lot of using visual perception for a child. Okay, next we go to the another one more level, the higher level, which is this one. If the child have good development of sensory, good development of gross motor and fine motor skill, good in visual perception, then we go to the cognitive performance, which is this is the highest level for a child.
Alia, sorry, yeah.
Yes.
So the visual sensory is almost the same, but it's not with
Yes,
the visual perception. So sometimes you get confused also. So meaning that the visual perception is how we interpret what we see.
Yes.
And then the visual sensory is about the sensory, the stimulation or the sensation that the eyes pick up lah.
Correct.
Okay. All right.
So actually the visual in the sensory, how our eyes react to the stimuli. Like example, maybe a child don't like bright light, maybe has difficulty with the dark room. That is a visual for sensory.
So it will give a reaction. So if the light is too bright, then we close the eyes, or we don't see. So this one is visual sensory.
Yes.
Visual perception is more on what we see and how we
interpret the result lah.
Okay.
So that's why normally some of teachers or parents or also OT maybe sometimes forget about the visual perception, because this one we just take granted like it's same like the visual sensory. Actually it's not.
Okay, so that's why sometimes the school or even outside we might say that, or maybe if the light is too bright, but sometimes it can be also visual difficulties like rabun jauh, short-sighted, rabun dekat, long-sighted. So these are all about the visual perception.
Yes, how the perception is more how their brain to interpret lah. To
pick up the information and then interpret inside lah.
Correct.
Oh, right.
That's mean the visual perception.
Okay, so it's also very important in when the child to carry out the functional skill and also the school.
Yes. Yes.
Oh, right.
Okay, next we go to the cognitive performance, which is how a person's ability to process the thought. Actually, in a cognitive performance, it have a lot of area that need to be covered. But before we go to performance that we need to use the cognitive, we go to the stages that development of cognitive. This one has been developed by Jean Piaget, which is we have 4 stages, which is sensory motor stage, pre-operational stage, concrete stage, and formal operational stage. For the first one, sensory motor stage, where this one will develop for a child from baby to 2 years old. Because this stage, the child will develop the sensory, as well as the motor performance. So in this stage, a child will learn about world through their sense and manipulate the object. That's why they develop the sensory and motor development in this stage. Then we go to the another one more level, pre-operational stage, which is this one will develop for a child from 2 years old to 7 years old, where this one will develop a child memory and imagination, as well as understanding their symbolic and understand the ideas of past and future. So in the pre-operational stage, this one, they start to develop the attention, the how to memorize the thing, how to initiate a task in this stage. Concrete stage is when this one will develop in child at age 7 to 11 years old, where this one is more, the child will more aware of external event and the feeling of others, as well as sharing feeling. So in this stage, the child will develop more complex cognitive performance, like example, solve a problem, or maybe do a judgment, a simple judgment, taking turns activity, something like they need, why they need to do that one, what the reason of this one. In this stage, they start to develop. And the last one is a formal operational stage, where this one will develop at in a children at age 11 and above, where this one will develop will focus on basic cognitive performance like executive function, which is like how they can solve a problem, do a complex judgment, or maybe how to have a good attention span and concentration and so on. So all of this stage is important for development, cognitive development for a child.
Okay, so let's say if a child is 8 years old, they supposed to be at concrete stage, right?
Yes, correct.
So if the child have not developed concrete stage, meaning that we have to go back to
To
the
the pre-operational
pre-operational
stage
stage
lah.
and to see if in terms of cognitive performance they already developed. If not, then we have to go back to the sensory motor stages. Am I correct?
Correct.
Okay.
Because through the sensory, they can develop the motor performance, and then from the motor performance, they can develop more functional, more cognitive performance like attention, like memory. That one is more basic for a child before they go to the complex part, which is solving problem, making decision, judgment, and so on.
So all OT normally when they detect the child is not at the current stage based on their physical age, then they will go back and see where is the difficulty for, or why is the cognitive performance is low.
Okay. Yes, correct.
Okay.
So the types of cognitive performance that we usually hear is attention span and concentration, memory, following instruction, sequencing. But actually in a cognitive performance, we have a lot of performance lah. Like example, in the executive function, we have problem solving, making decision, judgment, and also calculation. So that is will include in the executive function. While for memory, we have 3 types, which is short-term memory, working memory, and long-term memory. Short-term memory is how we memorize a thing in a few minutes. While for working memory, how we memorize the things in a few minutes, it's almost same like short term, but we keep it a little bit longer than short, but not too long as long term. And next is a long-term memory, is how we keep the information for a long period of time. Like example, how we can recall the past year events, something like that. Following instruction, we have 2 types, which is a verbal and visual. Which is the verbal, how we give the instruction. And for the visual instruction is how we write the instruction on a paper or on the whiteboard, how the child can follow the instruction that. For the sequencing is how the child can perform motor planning, what they need to do in a sequence. So how they know the sequence to do a task lah. So based on all of the cognitive performance, actually our brain already have 4 areas that divided into their own function. So for the first one is a frontal lobe. Frontal lobe is the infant area of our brain. This one more on the thinking, planning, problem solving, emotion, behavioral control, and decision making. So what we can, in a simple way, we can say that in the frontal lobe, more on how we think about how to perform the task. For the second part is temporal lobe, which is at the side, which is for memory, understanding, language, facial recognition, hearing, vision, speech, and emotion. So this area, how we can keep the memory, we can understand the language. So normally, if we see a person maybe has affected at the temporal lobe, they maybe have a difficulty to produce their language. So normally a child required frontal, temporal, and actually all of the lobe is important to develop a good performance, especially in cognitive performance lah. Parietal lobe is in the middle of the head, which is the perception, object classification, spelling, knowledge of number, visual spatial processing, where this one required for a child how to interpret what they have received lah.
Okay, so sometimes when doctors say that some of the lobe is affected or underdeveloped, so these are the things that can affect lah.
Correct. That's why the important we need to know is actually we need to know 4 lobe that the important area lah. And for the occipital lobe is at the back of our head. This one is more function for vision. So when we receive the input in front, the information will transmit to the occipital at the back of the head. And that's all for the important 4 lobe in our brain. And okay, so this is a cerebellum, and then we go to the cerebellum, which is the small brain at the back, which is the cerebellum more focused on gross and fine motor skill, eye-hand coordination, as well as balance. So this one for more on the motor activities.
Yeah. So for example, the one of the very well-known cerebellum issue or child is with where they call cerebral palsy, right?
Yes, correct.
Children with cerebral palsy, that's why you can see
they have difficulty with the motor function.
Yes, gross motor and fine motor function. So that's why the area that affected for children with cerebral palsy is where the cerebellum is affected.
Correct. So this is 5 areas that important for a child to develop good develop to perform functional skill in future. Okay, next. Okay, actually from all of the topic that I already discussed before, actually all of this is important for a child because from the sensory, gross motor, fine motor, and visual perception, they can lead to have a good cognitive performance before they can perform a functional skill. If one of these affected, it will affect the cognitive performance and also affect the functional skill.
Okay, so it's also important to know so that if the brain is affected, so some of the part is if it's affected based on the MRI from the doctor. So this is where they'll refer to an OT, right?
Correct.
So the OT will help the child to develop, and they can also tell parents that this lobe is affected. So that's why these are the function that will be affected, correct?
Yes, correct. So
So
that's
if
why
one
it's
of these,
important.
okay, so if one of these, like visual perception or fine motor is affected, then definitely the cognitive performance will get affected as well.
Yes, correct.
So you have, so meaning that when a child unable to perform cognitive tasks like decision making, that's where, especially children with special needs, so that's where we have to look at this main component lah.
Yes, correct.
All right.
So this is the main component actually, because underdeveloped of sensory will lead a child to have difficulty to perform gross motor and fine motor skill, and also the visual perception. But if they have a good sensory input, they can have a good gross motor skill, fine motor skill, and visual perception.
Okay. All right.
So actually, that's why when parents tell to OT that the child have difficulty to perform a task in school, actually it will lead to a lot of area we need to cover. Okay, so then we proceed to the types of activity that parents can do at home with your children in order to improve the sensory area, gross motor, fine motor, visual perception, as well as the cognitive performance. Okay, so we got the activity for sensory. Actually, a lot of activity we can use for
Alia,
sensory.
sorry, so we have a question. Is it for autism kid the frontal lobe is too big? For this area, this one have to refer to a doctor,
Yes.
because or a brain doctor or a developmental pediatrician or even a pediatrician, they are more knowledgeable in terms of how the brain are, because
Yes.
even children without special needs, sometimes they can have big or small frontal lobe, but that doesn't really affect the function, because the physical of the brain, we really have to refer to a doctors to understand.
Yes, correct. But we only tell about the lobe because we want to know which area that function to perform
Yes,
the task.
correct. And also sometimes we have children referred by neurologists, which is a brain specialist, where they say that the child doesn't have like autism or ADHD, but certain part of the brain is affected. So that's why Alia prepared something out of the special needs, like the child maybe have they fell when they're young, they hit the frontal lobe or they hit the occipital lobe behind. There's an injury or trauma. So that's where OT also can help the child, because this is not special need. The child the child unable to perform because of external trauma. So they are not born with it. They are not underdeveloped, but they are affected because of external factors like car accident, or when the child play, when he fall down, he hit the frontal lobe, he hit the side, he hit the occipital lobe. So we have cases like this where the children is not born with any type of special needs, but they exist because of the brains are affected,
Yes.
Yeah.
So that's why sometimes we can see that actually OT not only for help them in developing the functional skill, but we also help in help the child in adapting with the situation and how they can perform the task. Okay, next we go to the activity. For the sensory activity, we can do a lot of activities such as jumping, like this one is a jumping according to the colors, brushing, joint compression, touch a pom-pom, wheelbarrow, balance, throw and catch ball, deep pressure massage, touch various type of texture or various smells in the bottles, and taste several types of texture. All of this is we can do for sensory area.
Yeah. So one point to take note for all that join us today, what I've learned from Alia also, for sensory, we actually are treating in a way that not cure, but to help the child to normalize
Normalize.
with the
Correct.
sensory. So what this activity help is to help the child to cope with the sensory. So
Sensory.
when they avoid when they avoid something like touch, they don't like sticky stuff. So that's where the OT come in and help them to overcome or help them to increase the tolerance. So
Correct.
they can take it. So you cannot like headache, you take Panadol and you remove. So sensory
Yes.
is not like that. Sensory is basically you give activity, you practice so that they normalize, they know that, oh, it's okay, I can tolerate. So this activity, what OT do is to help the child to normalize with the sensory. So this is very important part because sometimes Alia or me, parents were asking how to cure sensory. We
Correct.
cannot cure, we can only help to increase the
Normalize.
tolerance, or we can, the term is called normalize. So so when it comes to intervention or therapy, this is what we talk about normalizing the sensory. You cannot remove the natural stimuli. You cannot remove the sun because the sun is forever bright.
Yes.
You cannot
Correct.
you cannot remove the person eye, but then you will, yeah, if you remove the eye, then definitely there's no input from the eye, then there's no eye. So these are the things that we cannot control or we cannot remove. So that's why a lot of misconception out there saying that,
Yes.
oh, we can treat sensory. Yes, treat but not cure. You can give therapy, but you cannot cure. That's why
Cure.
sometimes some parents will ask, why is the sensory integration therapy the most well-known therapy? They ask why until like 3, 4, 5 years down the road, the child or the teenager or the primary school student still need OT because that's why, because it's an ongoing process.
Correct.
OT will keep provide activity for parents, and that's why it's important for parents to do this activity at home to help them to build up the tolerance so
Correct.
they don't trigger behavior like avoid or seeking. Yeah, so yeah, this is for those who join us today to take note. It's a very important thing because I learned this from Alia also because a lot of parents ask us like, what is this? I thought you can help us to cure. But unfortunately, there is no cure. You can only normalize.
Yes. Because sensory will develop along the time, so that's why we can't cure that one. Maybe a certain area like maybe improvement in fine motor, gross motor, we can do to improve it. But for sensory, it's more focused on normalize it and how the child can tolerate with the texture, with the taste, with the smell, something like that. So we can reduce the avoidance response towards the texture or taste or smells like that. And also for the sensory activity that I don't include in here, which is play at the playground. Actually, play at the playground is a large area for sensory development because in a playground we have seesaw, we have slides, we have climbing activity and so on. So that's why at the playground, that's why OT usually will suggest the parents to bring your children to go playground because playground we have a lot of sensory input there. Okay, so I proceed to the next activity, which is a gross motor activity. This one where we use a large muscle. So we can do activity like climbing, stepping stones, bouncing on the gym ball, jumping, throw and catch ball, running activities. All of the gross motor activity. Actually, for one activity, if we downgrade when we break it down into a task analysis, we can get a lot of sensory, gross motor, fine motor, and visual perception, as well as cognitive area. Because from one activity, we can break down to a certain area to tackle. Next, we proceed with the fine motor activity, which is we use the finger. This one more on the tabletop activity actually. Compared to gross motor activity, gross motor we more focus on playing outside, but for fine motor skill, we more focus on tabletop activity. Like example, we stick the button, cutting, collage, lacing activity, clipping, piggy bank, knocking, and this one for finger strength, which is we stretch the rubber band. So this all of the activity that can we practice with our child at home. It's actually no need to buy an expensive toys actually, because we can use what we have in home. Like example, we have a basket like this, then we use the rubber band and put the toys inside, then ask the child to clip, or can ask the child to pick up the toys inside the basket. So that's why I'm always suggested to parents to not spend a lot of money on toys too much lah, because some of the toys they can just DIY at
Yeah.
home.
And also one of the things that I learned from Alia is some of the toys, OT, they have age range. So let's say this toys is for 3 to 4 years old. Then after 4 years old, that toys doesn't really function. So you have to upgrade. And then
buy a new one.
correct. Normally in a center, yes, we do use this because we have different kind of children be coming in. But like what Alia said, normally we don't really suggest parents to buy. And also when you execute such activity, after a long time, the child has a practice effect. So they know what to do. You can't really see if the child progress or not. So
Yes,
so please, if you have engaged OT outside, you can always ask them, because all the OT outside, they learn the same thing, standardized across Malaysia. We can work with the OT to ask for things for DIY, like rubber band. I learned this from Alia as well. Very good. You can do finger isolation by just putting the rubber band on your fingers and do this, and then change your finger. So you don't need a specific, I mean, they have specific tools, but you can
quite expensive lah if you want to buy, and sometimes the tools not useful so for a long time. So daripada membazir, baik kita guna macam ni lah.
And also other than but certain things like sensory you might need, like what I've seen also Alia have used is the oral stimulation, where they do brushing on the gum, brushing on the teeth inside the mouth. That one, something that we cannot DIY, then
We
the
need
one,
to buy it.
yeah, need to buy. This some, because some child maybe they have mild, but sometimes mild to severe, we need a specific tool. Then OT will recommend what type of equipment to get.
Correct. Okay, then we go to the visual perception activity. This activity more focused on worksheet. So actually visual perception, we have a games. If you can search online, you can search visual perception game that will keluar banyak lah website. So we can try to practice the visual perception activity, cognitive activity inside. Like example, we have look and find like hidden figures. This one more on find the matching, and this one word search. This one more on figure ground, how they can discriminate the same picture. But for the activity or toys that physically we need to use, we can use lacing activity, copying tasks, or maybe sorting a cards. This one is like activity for visual perception tasks. So parents also can try something interesting with your child at home to perform the activity visual perception lah. Next is a cognitive activity. This one also almost same with the visual perception task, but this one I'm not use a lot of worksheet lah, because for cognitive performance, all of the games, all of the activity that we do, actually we need use the cognitive performance. Like example, when we do activity throw and catch ball, maybe we see that, oh, we use the gross motor input, but actually throw and catch ball, the child also need to use the good cognitive performance, because they need to make a decision how I want to catch the ball, how much strength that I need to throw the ball. So that's the reason why cognitive performance actually not use this kind of activity a lot, because when you do a task, in a one task we can get the cognitive performance input also lah. So I'm very suggested to parents to do word search, and sometimes I'm suggested to parents to do find hidden figure, because other than help them for visual perception, it also will help them in cognitive performance, because both of these one is like a cognitive stimulation for a child. So that's all for today. So I hope this sharing can help a teacher and parents to discover more about your child development and how to know that a child is very prepared to go to school and performing a good performance at their school.
Okay, we have a question which just now in the beginning, a parent asked, for concentration, attention skill, what kind of activity they can do at home?
For concentration, what?
Concentration, attention span.
For concentration and attention, for attention span and concentration activities.
Yes.
Okay, this one I'm very suggested to parents. Actually, all of this required concentration and attention span to perform a task, but the parents can do activity like giving a time to complete a task, because some of the child maybe do the task in too fast pace or too slow speed. So to reducing the speed or to increase the speed, so parents can use timer to reassess or to macam compare kan, okay, the first time dia buat banyak masa ni, then we try to gradually reducing or gradually increasing time. And also we can gradually the number of times, like example we do word search. Initially we do find 5 words, then gradually we increase from 5 to 8 to 10 to 20 or something else. So like in a game, we have a level 1, level 2, level 3. So we gradually increase like that.
Okay. And also one more thing, like what for the parents that or teachers that ask about attention, like what Alia have mentioned just now, attention require a lot of other skills as well. So it's very broad when we talk about attention. Like Alia said, if we talk about attention itself, a lot of things we need to check because attention considered cognitive performance, which is way up the pyramid. So when we talk about attention, maybe the sensory is affected or the sensory motor. So these are the things that we have to go and check, investigate what is affecting the attention. And then as for the activity, like what Alia have shared, a lot of activities that she suggested just now require a lot of attention.
Yes.
Okay, so you can start with something easy. So once the child pick up, you can also, like what Alia suggested, look at the timer. So you can see if they improve. Maybe 5 word search, they take about 5 minutes. Then after working on what is going on with him or your child, and then you can slowly reduce the time and they can finish faster.
Yes,
Because
correct.
cognitive performance itself, it covers a lot of things and a lot of sensory motor, all visual perception. Okay, and then you can, for those who missed out the activity, you can find our video in the Facebook, and then you can scroll it back and pause, and then you can see what other activities are suggested.
Yes. Also, you check again with the video that I shared in Afternoon with Alia. So they also have several activity that can use in sensory area, fine motor, as well as the gross motor area.
Yeah. So, so sometimes for those who have experience with OT, they will know that OT takes some time also to identify. For those who are new and not very sure about OT, and these or teachers that working with children with special needs. So when we talk about one component, actually it ties in a lot. So one activity that OT gives actually it includes a lot of things. We not just talk about attention, we talk about the sensory all in one package. So like the pyramid, like what Alia.
Pyramid of learning just now I show lah.
Yeah, correct. So then we can know at what level, because I believe OT also they have their own developmental milestone. Like she shared the 4 stages of the cognitive performance. So your child is 8 to 10, they're supposed to be at this concrete stage, but maybe because previously there's something that affects your child, so we cannot stay in concrete. We have to go back, and then the OT have to start working on it to bring up the pace, the skills. So, okay, any other questions?
Okay. So I would like to suggest to parents that before we can conclude our child, or maybe they have this kind of behavior because of they don't know to do this one, or maybe they don't know to perform the task. Actually, they act like that because of they do not know, or maybe because of the sensory input. So that's why I'm like to suggest to parents to recheck back with the pyramid of learning, because that is our foundation, why the child can develop, or why the child can perform this acting in performing a task.
Okay. We have a question. Do you have any more tips for tantrum control?
Okay, so for the tantrum control, has that one, what did I know? We can try some things using time out activity, as well as we can introduce with the sensory. Maybe because they tantrum, maybe because they do. We need to know why they tantrum. Firstly, we need to know why they tantrum.
Yeah.
Then when we know why they tantrum, maybe because, like example, they tantrum because they want a handphone.
Yeah.
So if we don't give the handphone, we try to check to encourage them to play something else, like maybe throw and catch ball, or maybe something, some physical activities,
Yeah.
or sensory tasks. Then after that, maybe it can help the child to reducing the tantrum.
Yeah. So also like for just now, Alia did mention that the tantrum or behavior, if it's related to sensory, OT can help you to address.
Yes.
But if it's because of like external, like what handphone, maybe this is the part where if you talk about behavior itself, we have to see
see the behavior therapist.
Correct. Is it sensory related or not?
Yes.
If it's not sensory related, then that's where you have to check with a behavior therapist. Because if it's
Correct.
sensory related, then if it's based on sensory, like what Alia has explained, it can be hyper, too much, they
Hyper or
avoid,
hyper.
they run away, they start crying, they cannot stop crying, they don't want to do the task. Then OT will come in and help. Yeah. Okay, and then OT will know which part of the pyramid kids went wrong, right? For this one, yes, because Alia also
Yes.
did mention that all the OT are using
The
standardized.
same pyramid one.
Yes, the same pyramid in Malaysia. Everyone who study as a OT, they will learn about OT, and then from there they can explain to you what went wrong. Within the pyramid, they can tell you what difficulty your child has experiencing. And then other than that, how to tackle the child impulsiveness.
Oh, this one is depends on how the child sensory input not developed enough. Maybe normally we can see because of the sensory of tactile, sensory of vision. When a child have like to see a moving object, and then when we take out them from the situation or the scenario, so they become meltdown and difficult to control. So what we can do is we need to calm him down first, then we do the calm down is like not you need to calm down, not using words only, but we need to use physical touch, like hug them, like apa ni, explain to them slowly, not use the high voice. And then we try to get some sensory input or some alternative activity, like example, we use a finger spinning, some things like that.
Yeah. So yeah, for impulsiveness as well, give you an example where I personally experienced that I have to refer to Alia. If this child in a class setting, a teacher feedback that this child tend to rush things.
Yes.
Tend to rush exercise, tends to
read
walk out
something.
of the class.
Yes.
And then when the bell ring, tring, time for go recess, he will run straight. He cannot stop. So, and then this is where we try to identify what's going on. That's where Alia, OT, they come in, they found out that it's sensory related. One
Correct.
thing is the child, he cannot take too many noise in the class. The
Yes.
fan in the class, the aircon, and then children talking. So the child become impulsive. They want to get away from that class as fast as possible. And then also, one thing also I learned from Alia is that when given a task, the teacher asks the child to finish the work, he will just simply write and then he just finish. This one also we found out that based from the OT observation and assessment, the child has they cannot tolerate with the demand because of they are unable to the cognitive performance is quite low, where they feel the task is very hard, but they just want to finish it, and then
they just go
they
out.
Don't want to, yeah, they just go out from there. So this is where everything is related to sensory. This is where we have to refer to an OT. So that's why a lot of children with or without special needs, sometimes OT can come in and help because like in the beginning of the workshop, we did share that OT, occupational, means,
Occupation.
Yeah, they try to restore or help you to go back to your original occupation. So for child, if having difficulty at class, we have to check, if we send for an OT, things like behavior, impulsiveness, we have to check if it's sensory related. If it's not sensory related, then we will refer to someone what we call a behavior therapist. So they also will work closely with OT. One will address the sensory, the other one will address the output. of the behavior. Because
Behavior.
of this avoidance, because avoiding sensory, then the behavior will come in how to replace this behavior. So you can see a lot of health professionals, they tend to work closely
Yes.
together, like speech. A child cannot
Produce a language.
yes, produce language, and then also the attention. A lot of our what we experience here is attention difficulty. So that's where
Yes.
the OT, that's where the physiotherapy, speech, they will refer to OT. Then that's where OT will find out what is affecting the child's concentration. Is it because of sensory? Is it because of the sensory motor? So this is where OT will come in and help to address. Like also Alia shared that sensory is the biggest, okay, the most basic one, and it will affect the most. And it, like Alia said, because us, other than Alia, we are not trained, we are not a trained OT, so we normally don't talk about sensory.
Sensory, correct.
So sometimes parents come to me or they will say that why doctor asked me to go OT? What is OT? So basically that's where the doctor might find out that some part of the maybe fine motor skill, or sometimes the kids they gully or they close their eyes or they close the ear when the music play, they close the ear. So this is the obvious part. That's why the doctors will say, okay, refer to an OT. Attention is something that's very big that OT deal with.
Correct.
So this
Because
is
it need a lot of area to be covered, so that's why attention we need more for macam perlukan lebih banyak. Itulah cara untuk tackle.
okay. So we are already at the end of our workshop. So for those who are interested to know more, Alia will be running a short course on skills for school. Basically, she will go in details about the component that we discussed before. So she will have it in 6 sessions, a short course, and each session she will talk about what is affecting the child, the tips of activities and helping your child. This is basically preparing your child for school. So it's applicable for children with special needs or without special needs.
Right, especially for 4 years old and above lah, where they want to go to school, so we try to prepare them with several areas like this lah.
Correct. So this is where she will go in depth to talk about more about how to help the child. All right. Thank you everyone for attending our workshop today. If you have any question that we couldn't answer, feel free to post in the comment. We can always come back and provide you answer. All right. Okay.
Okay.
Right. Thank you everyone. See you in the next workshop. Thank you, Alia.
All right. Thank you, Charlie.